Greetings, one and all. Here we are live again on YouTube. So many people have been writing in comments of our regular videos we put out twice a week. Where are the lives? Why aren't you doing live anymore? I'm not getting notifications on live, and I apologize. I think the last live we did was with Dr. Gawayne, where we were both doing it live at the same time. It would switch back and forth between us, and that was a lot of fun. It takes a lot of coordination with, oh, look at that. Wow. LeeAnn decided to walk across our live YouTube. How nice. You guys, go ahead and do comment so we can have a conversation. The chat lines are open. Tell us where you're from. Tell us what you want to talk about. Okay, we got LBTV. Hi, we're glad to have you be a part of things. And in between, I'll give you guys the update on Dr. Gawayne. Oh, there she goes again. Yes, good afternoon. Oh, also, you guys tell me, is audio okay? Being that I'm outdoors, I don't know what it sounds like for you guys, so let me know if you're able to understand what I am saying. Thank you for the thumbs ups too. We appreciate the likes. South Carolina, Jamie1178, we're glad to have you be a part of things. Apparently I have a very bad connection, so I wouldn't be surprised if it's cutting in and out, and if you guys are getting just audio or just picture, but hopefully that'll correct itself here. And Lita131 loves Auburn Medical Group. Thank you, Lita. Claire, okay, it says Claire's mom. So Claire, are you doing it on your mom's iPad or something? And, oh wait, is this the Claire from Chicago that's also on Twitter? Is that Claire Schaefer's? I'm not sure. Correct me if I'm wrong, but I believe that's you. Still says bad connection, so I don't even know if you guys are getting it, but I hope you are. Being outdoor, not only do I have questions about is the sound good for you, but also is the connection good to the Wi-Fi, which is what I use. So the update on Dr. Gawayne, he will probably not be doing a lot of the live YouTube. We thought that maybe we'd get this going where we'd actually have both of us on and switch back and forth. Oh, thank you, Van Dial, for letting me know that the sound is great, but the connection's bad, and I'm not sure how we're going to correct that. Probably not for this particular one, unless they end up going in the house where Lisa's making some cookies, which we could end up doing. Claire's from Santa Ynez, so that, oh, Claire Chavez. So no, not Claire Schaefer's, different Claire, from Santa Ynez, which if I was to guess I would say is in Southern California, but I don't know for sure, just because I know that's where the Santa Ynez Mountains are, right behind Santa Barbara area. Rebecca says I sound great. Probably have the bad connection. Genelgan, hi. Yes, thank you for greeting. And if you guys do need me to go inside because of the connection, I will. Just let me know. So Dr. Gawayne and I probably won't be doing the two-person live YouTubes. It looks like it'll probably be just myself, even though I feel like the content is so much better when I have somebody smart and young and hip and quick-witted like Dr. Gawayne. But he is going to do something. Yeah, he does have a little thing he's going to do for us, and that is to have a blog, which he is working on. He's let me read his first 2 blog entries, and I'm very excited about them. They're not live yet. He's going to get a collection of them before he puts them up. Coco Mama 67, good to see you also. Rebecca Thompson, smell of it. Oh, you'd like to smell? Oh, you mean because of cookies, right? Right. Okay, Carl, come and visit Knoxville. You know, I've actually given no thought to visiting Knoxville. I'm glad that you mentioned it, because otherwise I never would have thought of it. We'll have to do a live event there. Wouldn't that be cool? Just like other YouTubers have the doctor on YouTube going around doing live events. I'm not sure what we do. Ear cleanings on a stage. If you guys have ideas, let me know. Norway. Ooh, okay-ish connection. Actually, the connection seems to be much better now. And Norway that's amazing that it's people so far away. I would make a comment about our patron, Petra from Sweden, except I know that whole Norway, Sweden, Finland, you guys, I'll leave that to you guys. I won't take sides on that. Dr. Gawayne's, okay, I've read the 2 entries. They're very good. Yes, I know, Claire. I tell him that, but he's excited about doing the writing, and you guys will like it too. Rebecca Thompson thinks the cookies, okay. Oh, that's what you could smell of. Oh, and BooBoo, thank you for joining us. So glad to see you be on the YouTubes here with us. We appreciate you being there. Yes, he feels he's a better writer than speaker, and so he's going to let you guys into a little bit of his mind through the pen or the keyboard, as it may be. And I'll give you, I won't tell you what the the posts are, but I will give you a little bit of information kind of about them in general. I will say I'm blown away, and he sent them to me first, and we had a conversation about the posts, and he is a funny speaker. I keep telling him that. Good day, fine sir, to you, Maximilian, also. Dr. Gawayne, in writing his posts, I talked to him about how incredibly personal the material was, and what's the word for it? Self-deprecating. Maybe that's not quite the way to say it, but very very vulnerable is what he is. More vids, please, in Whittemar. Whittemar. Tell me where Whittemar is, and maybe we can make some more videos there. I live in California. I don't know where Whittemar is. So please tell me what part of the state you're in, because we do travel to different parts of the state for vacation and for visiting college and conferences and YouTube and VidCon, and so let us know. It might be somewhere where you end up. Anyway, back to Dr. Gawayne's posts on his blog that is not live yet. I won't tell you the domain yet, mainly because he hasn't bought it yet. Is he upset that we said he blended into the back? I don't think that's what it was, no. But thanks for asking. And from Pittsburgh. Now Pittsburgh's interesting because somebody we've been talking about already on this podcast is in Pittsburgh right now. Not Pittsburgh, but just outside of Pittsburgh, at a wedding of his brother. The connection is better. We'll miss seeing Dr. Gawayne. Well, if you're in Pittsburgh, and if you're going to a wedding today, you just might find him. Molly Becker, please catch me up. I just joined. Okay, Molly, we're going to do an update for all the people who have joined since we started. Try to make it brief. It's by Temecula, which sounds very deserty, and I think maybe it's around San Diego, but I'm not sure. Because I've never been to Temecula either. And Lita, 131. It's not working. All I see is a picture of you. I've got a good connection now, so I'm going to say that's on your end, because everybody else isn't describing us having a problem right now. So the update. Dr. Gawayne probably won't be doing the two-person live like we did on our last two live ones, but he is going to start a blog. The posts are deeply personal, being very vulnerable about things. It's hard as a doctor to, yes, thank you, Rosa, I see the connection. Hard to share that outside of just very close people or other physicians, the sort of things he's saying. So it'll give you a rare insight. I think he's quite an individual to share the way he is. Okay, Riverside County. Thank you for being more specific for me, because I do know where Riverside County is, because it's where Riverside is, and it's east of L.A. County. Hello from Loon, Mississippi. Thank you, LaDonna. We're glad to have you be a part of things. Yeah, this blog he's doing will be a view that will give you. Now he says things I think, do you want to say those to people who don't have the same perspective of being in medicine? One of the things that he touches on is, well, even that very vulnerability itself, how doctors are. I don't want to say too much because I don't want to steal his thunder. But a bit of a impersonalization, shall we say, and he breaks through that for the reader. Michigan, but from Nebraska. Molly Becker is from Nebraska, and we will be in Nebraska sometime this summer. So somewhere around Central City, Aurora, spend some time there, which is where Kara is now. If any of you know Kara, she's in Nebraska right now, and we'll be driving out with her grandma and grandpa sometime in the middle this week to come back home for graduation for Lisa, which is exciting. I know you guys are excited about that too, those of you who follow Lisa. I say follow Lisa loosely because the only way you can follow Lisa is when she happens to walk behind me or walks in the kitchen when we're doing the broadcast from the live YouTube from the kitchen. I keep telling her she should have her own YouTube channel, that she could actually do that as like a side business when she's in college to get some spending money, but she hasn't grabbed onto it and done it yet. Okay, Teddy, yes, we'll address Teddy's and then I'll tell you what I was going to say. Hello, sir, it's a pleasure to meet you. This is the first time I've spoken to anyone on a live chat. Well, welcome to it. And yes, Teddy has a bad connection. Boo-boo, come on, Gawayne. Really like you. Your sense of humor is warped. I mean, fun. Rebecca, come to Utah. Utah, okay, Rebecca. There is an event called CVX or CVX Live in Utah in early August for YouTubers. And I have kind of looked at that and thought, maybe if a lot of people will be there, we'll try the VidCon thing first in late June, and then if I have just a convincing compulsion to go to CVX, it'll be at the Salt Palace. Then I'll consider that. And Kristen Mariah from Texas, love watching the earwax cleaning videos. It's so pleasing, makes me want one. And also Teddy is from Texas. So all you Texans that like ear cleaning videos, I know we haven't had one for a while. Somebody was asking about that on a recent comment on a recent video, that we haven't had any ear cleans. They want them. Well, there have been ear cleanings in the office. It's just I wasn't a part of them. And I tell them afterwards, hey, people really want to see these. Save them, share them. But it was a patient who wasn't into it, or it was really busy in the office, so I apologize for that. And Bernadette, no weddings on your schedule today. Okay, so maybe you're not going to that one. South Hills? I didn't hear South Hills. It's actually north of Pittsburgh where they are. Molly Becker, do you have any blackhead and earwax videos coming up? None that have been recorded yet. I'll say it that way. And of course, BooBoo would watch a Lisa channel. Thank you. I will tell her that you would watch a Lisa channel in an effort to try to get her to have her own channel, because I think she could, seeing what's out there, I think she'd do a great job. So, because a lot of people may be expecting medical content on the Auburn Medical Group channel, I'll open it up to medical topics if you guys have something. Audrey from East Tennessee again. Audrey has a question. Audrey, you are welcome to ask your question. And I've got to say, your little avatar there makes me think of Florence Henderson when I see it. Now, it may look nothing like Florence Henderson. It's just, that tiny little circle on my phone, but that's what makes me think of Florence Henderson with more curls. Jan Hill, first live stream with... Oh, Jan, I'm glad you got us. Obviously, all of you people have your notifications set up in such a way that you can catch live streams when they're happening. A lot of people don't have their settings set up, but hey, you can teach all of your friends how to put the live settings correct on their phones and mobile devices so they can catch us. Rosa, when will you have some videos for us? I do every Tuesday and Friday. I have videos for you. I haven't stopped that in, what is it now? Not 18 months, 20 months? Oh, look. Did you see that? Okay, here we go, Audrey. What are the plus minus with cholesterol medication? And I know I spelled the actually it's cholest. I think you just left out cholest. You just left out an E, I believe. Okay, pluses and minuses. Cholesterol medicines. I'm glad you brought that up. So we're going to talk about cholesterol medicines. The only way that cholesterol medicines can get interrupted now that I've started on it. Okay, we'll talk about Molly, but nobody else. The only way that we can be interrupted is by a super chat. Okay, Molly, my hip is... Okay, Molly, that's medical. So since Audrey got me first, she'll get it. Anything else will have to be a super chat until I'm done talking to Audrey about cholesterol. Okay, so to call them cholesterol medicines, which is kind of how they were promoted by the manufacturers, the drug industry that makes them, is a bit of a misnomer. I mean, they do work on cholesterol. They do lower cholesterol. They do lower LDL, or the bad cholesterol. But here's the interesting thing. We prescribe statins, a type of medicine that lowers cholesterol, to people who have normal cholesterol. The people that need it are people who've had a stroke and people who have diabetes. These are two groups of people who, even though they have a normal cholesterol level, benefit, at least as a group, when you do big studies, benefit from taking a statin drug with a lower incidence of heart disease and stroke. Now, it may be also true for people who had a heart attack or heart disease if they have a low cholesterol level. It may be beneficial to them. I actually can't recall that data right now, or I have not seen that, but I do know stroke and I do know diabetes. So kind of an interesting thing. These people have a normal cholesterol or even low, but yet they benefit from a statin. So the thinking is maybe there's something else going on. Some people use the word anti-inflammatory to describe this. This is not to be confused with over-the-counter anti-inflammatory medicines like the non-steroidal anti-inflammatory drugs, ibuprofen, naproxen, those sort of things. Some other type of anti-inflammatory benefit is what we're thinking. So, now what about people with high cholesterol? Well, you also have people with cholesterol that's elevated, and you wouldn't necessarily give them a statin if they're young, don't have a family history of heart disease, have normal blood pressure, don't have diabetes, on and on and on. So how do we determine for these in-between people whether a statin drug is recommended or not. Well, I'll tell you exactly where you can go and do the calculations for yourself, but you're going to need some numbers. You're going to need your systolic blood pressure, and some of them even ask for a diastolic blood pressure. You're going to need your LDL cholesterol and your HDL cholesterol, and your age, which hopefully you know, and race, because apparently that actually makes a difference. So the American Heart Association and the American College of Cardiology have this thing they call a risk calculator, and you can find it online just simply by putting in for Google or your other unnamed search provider, AHA, those three letters, ACC, risk calculator, and you get some results. I like the second one that comes up myself. There's a little slight difference between them. I like the second one. So you put in your numbers there, and you get this anonymous exchange of your personal healthcare data, because you don't have to put in your name, and it will tell you your risk of having a heart attack or stroke in the next 10 years. And if you're young enough, lifetime risk. It'll also tell you on both of those what your ideal risk would be if you did something. And then it'll have a way that you can click to find out, well, what is it you recommend? Well, quite often what it'll recommend is, if you're not already eating a heart healthy diet, like the DASH plan or getting regular exercise, that you can do those, but it also oftentimes recommend use of a statin drug, and it'll say either a low dose or moderate to high dose statin drug to lower your risk to the, or at least to approximate the lower number for your risk, or what should be achievable for somebody in your age and your gender and your race. So we do that with patients. Usually we do it either if we've got a cholesterol level or if we're doing their annual wellness visit, we'll go over that. And if it's recommending it, I'll have this conversation with them. I'll say, this drug, if given to a huge group of people with numbers, these numbers, the same as you, a certain percentage of them, which we'll figure out based on what their percentages are, you know, the difference between their ideal and what their risk currently is for heart disease or stroke, a certain number of them will avoid having a heart attack or stroke. And we'll say a percentage. So say, for example, if it says you can get your risk down to 8%, and your risk is currently, say, 15%, or 7%. Let's make the numbers easy to work with. Say your risk get down to 8%, but it's currently 13%. So a 5% difference. So some people will say, oh, wow, 5% compared to 8%, that's, what is that, 40% improvement? I don't say that. I say, no. 5% is 5%. You take away 8 from 13, it's 5. So you can lower your risk 5%. So if there were 20 people just like you who decided to take this medicine, one of them would benefit from it. The other 19 would put themselves at the expense and risk of side effects and inconvenience of having to take this medicine for 10 plus years, get no benefit from it. So there's two ways you can look at that. You can say, only 1 in 20 gets benefit. I'm not doing that. Or you can look at it and say, hey, that one person avoided a heart attack or stroke. That's a big deal. I'm going to take it. And I will frame the argument both ways for my patients so that they can decide what kind of person are they. Are they glass half full or are they glass half empty? I let them choose. And then I fully support that decision. And I since they chose one way or the other, I will kind of reinforce, yeah, why would you do that when there's only one, or the other way, or I'll say, yeah, that's a good decision. That's a heart attack or stroke you're avoiding. But I let them decide which way they're going to look at the numbers, and I give them both options. So some will choose to do the medicine, some will not. Now you asked, also Audrey asked about the minuses of cholesterol medicines. There are minuses. You could have, with any medicine, you can have a life-threatening allergic reaction to it. That would be a minus. Very rare, very rare. So rare that it's not a reason not to take something. With the cholesterol medicines, we have people who will have a common side effect of it causing injury to their muscle, what we call myositis, where they'll actually have breakdown of muscle, and we'll see little pieces of muscle, essentially, something called CPK, or creatine phosphokinase, elevated in their blood levels, and they'll be sore, especially the proximal muscles, like around the shoulders or around the buttocks, the proximal legs, big muscles of the body. They'll be sore and they'll be weak. And then after you stop the medicine, Usually in a few weeks it starts to improve. Rarely the people have a very slow improvement from that. Rarely. Very slow improvement from that, and it really puts them down for quite a while, and it can be a significant problem, even if they do eventually get over it, a significant effect on a portion of their life. Rare that it's that bad. Also, oftentimes their liver will be damaged by these medicines. Very, very rare. We check the liver function test at 6 weeks, 12 weeks, 6 months, or go to 1 year, every year thereafter, to make sure that it's not hurting their liver. And if we see it bump up a little bit, we watch it. Usually don't have to do anything more than watch it, because if it's a little bump, these numbers are usually like in the 30s to 50s. And if they bump up to the 60s, we'll watch it. If they bump up in the hundreds, I take them off of it and say, let's take a different approach to this. So Audrey, I hope that, and I'd like to hear from you, Audrey, I hope that gives you a better understanding of cholesterol drugs. I'll even expand it a little bit and tell you there are other medicines that were around before the statins. Statins are also called the HMG-CoA reductase inhibitors. Not much reason for me to tell that to a general audience, but just thought I'd show off there by knowing that. There's other medicines that bind cholesterol in the gut and help keep it from being absorbed or from being reabsorbed, as the case may be, because it comes through the bile. And these binding agents are a little harder on the liver, don't work as well, may have some other side effects that I can't think of off the top of my head. Not all that significant, though, because I'm not prescribing it, because I'm prescribing statins because they're a better solution to it, and now they're available generic. Even Lipitor is available generic now. There is one I like better than Lipitor, but rarely ever prescribe it, even though I like it better, called Rosuvastatin, it's a generic name, or Crestor. As soon as it goes generic, it's going to take the place of a lot of new prescriptions, at least for me. And the reason I like it is because at a much lower dose, much less statin chemical in the body, it gets better numbers, better results. And so people whose cholesterol won't come down with Lipitor or Simvastatin, Zocor, or Pravastatin, I will put them on Zocor, or on, I already forgot the name, Crestor, and we'll actually get the cholesterol down fine. Oh, Audrey, okay, thank you so much. A few weeks ago, my honey's cardiologist put him on a cholesterol medication while he has good numbers. He explained, the doctor, but I didn't get a good understanding of it. Thank you. Yeah, get your husband's numbers if you have his blood pressure and his lipid panel results, and run them through that thing on the internet. AHA-ACC, American Heart Association, American College of Cardiology, risk calculator, and then you can follow it for yourself. And it's a very crude instrument. It's not accurate. I shouldn't say it's not accurate, but we don't think of it as being the definitive thing, but it is a useful tool that we use, which is true of so many tests and surveys that we use to try to guide people in their health. They're not perfect. There's many other things that come to the whole cholesterol equation. Many people will take into account lipoprotein small a, or homocysteine, or the cardiac CRP. And I've talked before about why I don't use those and don't get those on my patients. I don't know if you guys can hear the neighbors yelling. And the reason is because we start to get down and down and down and down on how much difference we're going to make. Remember I gave you that argument of, 1 in 20 is going to benefit from the statin drug for the cholesterol. Well, it's smaller than that. It's like a 20th of that when you start factoring in things like the lipoprotein small a and the ratios and the CRP and the homocysteine and what you're going to do about that. So I leave that to the cardiologist if they want to dial in that deep. But for people who aren't seeing a cardiologist, it's just not that much of a difference. You're focusing on minutia. That's the chance of it making a difference is so small. You really need to be worrying about other things. It doesn't make sense in the big picture to be looking at those. That's my opinion. And Audrey, you say here, whoa, we're already on low power on the battery. Is there a special reason Crestor helps more? Just works better. Just better per milligram. That's as specific as I can be with my very poor knowledge of the pharmacology and the biochemistry involved there. I'm sure somebody else can give you a better answer who's more knowledgeable about it than myself. So with having finished Audrey Bunch's question, not having any super chats, we're now open to other medical topics that you guys have been dying to talk about. And for those of you who came in late and say, hey, you're not commenting, not seeing my chat, that's because we only recognize super chat once we get a medical topic started. So now the phone lines are open. Molly, hip, Molly Becker says hip. Thank you, Molly. Oh, yeah, you were asking something about the hip uh, that you said before. Well, I could go back all the way through and spend the time looking for that, but I'm not going to. Somebody had a thoracotomy when he was 7. Wow. Thoracotomy being opening of the thorax, just operation. Just barbaric, cutting ribs and pulling them open. Uh, and if I could remember what Molly asked about the hip, I would actually address that. Okay, Molly got me. I'm looking back. Been hurting for 3 years. I play volleyball and I dance, but I strongly believe that is not the cause. And Molly, I don't know if you're familiar with how we do things here. When questions are asked that are very personal about health, I won't touch them. And the reason is because that could be interpreted as practicing medicine. And I practice medicine with my patients, not with my people who follow on the internet, unless they happen to be my patients. And that's a rule that I follow, and it's based on recommendations and my interpretation of them from the State of California Department of Consumer Affairs Medical Board. Okay, moving on. And okay, hurting for 3 years. No doctor has given me a diagnosis that has helped. And yeah, that is just way too general. There are way too many things that can cause pain in an area somebody describes as the hip. Of course, people will describe all sorts of things as the hip. They'll describe where the actual hip joint is located. They'll describe their iliac crest as hip. Anything of the buttock or waist, sometimes people will call their hip. All right. And what is BooBoo Kitty saying? What is that in here? Oh, thank you for asking. Yes. What is in my hand? Thank you for asking, BooBoo. And no, it is not a cucumber. It's a screwdriver that I wanted to show because it was sitting next to my microphone and tripod when I grabbed them. And I thought, oh, this is kind of interesting. I'll just throw out a little promo for getting outdoors when you do your exercise. Because I think there's a health component to being outdoors when you get your exercise. And when I was running home this week, I saw this screwdriver on the shoulder, and I stopped and went back and got it, and now I have a screwdriver because, sometimes you need a flathead screwdriver when you took all your tools you had at home to the office for working on things there, and so screwdriver with a wooden handle. That's what that's all about. Linda, only if it bothering you, Dolores. Is it Dolores or Mulva? Okay, Abby Richards, my triglyceride are only 51. I think you're probably looking at your triglycerides. My mom has a ganglion cyst. This is Dolores. My mom has a ganglion cyst in her hand and had multiple surgeries to remove it, but the cyst kept coming back. Yes, they will. Even if you have an operation, they can still come back. That's why I'm not quick to tell people to get an operation on ganglion cyst. Oftentimes they'll go away on their own too. Kept coming back. I have the same cyst. Really? Is there some kind of surgery that joined your hand to your mom's hand? So you guys share the same cyst? Is it worth trying to remove it? Or if it's not hurting you at all, leave it. Absolutely leave it. Because anything we do to ganglion cysts, they come back. And doing nothing to them, they leave. See? It's not there. It left. Okay. Looks like a screwdriver. Somewhat. Why does this smell so bad? I hear you guys always talk, it smells bad. Okay, you're probably talking about the epidermoid cysts. And you know what? Actually, an epidermoid cyst does have an odor to it, and it's because of the oils, the skin oils. But they're much worse when they're inflamed, because then you get pus in it too. And there's a little different smell. Easy way to get free screwdriver. Yes, it is. Claire, good for you. That's a good one. No, thank you. And hi to Dremsky91. Abby, I'm on X-Ray Tech News. I'm in X-Ray Tech News. You are in X-Ray Tech News. Okay, Abby, interesting. I'm in X-Ray Tech News. I don't know what an X-Ray Tech News is, but I'm sure it's interesting. All right, backing up a little bit so that now 11. Now 11. Okay, Ian, is that a Japanese maple behind you? Behind your left shoulder. This is my left shoulder. And for, who's this for again? Oh, this is for Ian. Ian, there's the Japanese maple. Yes, or Japanese, I guess. Yeah, I think that's what it is, a Japanese maple. They grow well here in Northern California in the foothills because you see them everywhere, and they're a pretty tree with those little leaves. Okay, Audrey, cracking me up with X-Ray Tech News. I think it was just a mistyping. Tammy, what is gastroparesis and PSC caused from? PSC, not sure on the PSC, but gastroparesis is, you take the word gastro, which is stomach, paresis, which is weakness, not quite paralysis. Paresis is a weakness rather than true paralyzation. What's the word I'm looking for? Paralysis is the word I'm looking for. So gastroparesis is a weakening of the stomach. It's actually a slowing of the muscular contraction of the stomach that moves the food along. So people with gastroparesis, or some people pronounce it gastroparesis, will have their food just sit in their stomach and not go anywhere. Well, you can imagine this could be a problem because you need to eat, and in doing that, your food needs to get through the stomach. So if food's already sitting in there, you really don't feel like eating. You get this early satiety, meaning that you're satisfied and don't want to eat, don't have hunger, and sometimes even vomiting after you eat. If there's nowhere for the food to go, it comes up. Oftentimes associated with muscular problems, neuromuscular problems, diabetes. People with bad diabetes will have this problem. Some medicines are used to help with it. One of them is a prokinetic, meaning promoting movement medicine, called Reglan or metclopropamide, that helps the smooth muscle to move. Again, he's excited. I don't know if you guys are hearing all the words. There's some expletives. Can I speak about people who use expletives and my opinion of their intelligence? I understand that some words have a function in the English language and provide a particular emphasis at certain times. But when you're using a certain four-letter word in every sentence, and sometimes twice in a sentence, you appear to me to not have a high level of mastery of a vocabulary. I'll leave it at that and not get any more insulting. Okay, back up to you guys there. Primary sclerosing cholangitis. Oh, wow. Okay, let's break it down. Primary means it's not due to something else. It's the problem in itself. Sclerosing is a hardening, thickening, usually some kind of a bad change in a tissue. Cholangitis, the chole refers to gallbladder and the ducts associated with it. Cholangitis, I may make a mistake here, and I'll go out on a limb. If other doctors are on, they can correct me. And angitis, an itis is an inflammation of something. Angitis would be of angio, a blood vessel, so a blood vessel associated with the gallbladder. Thickening of the arteries of the gallbladder would be kind of a way to interpret that word, but that's not actually what primary sclerosing cholangitis is. It's actually a problem with the ducts associated with the gallbladder. People can get sick from it because it can affect their liver. And I think there's some other things that go on with it. Not being a GI doctor and handing that off to a GI doctor as soon as I see it, I'm not able to help you that much about understanding its significance or treatment. Yeah, I'm going to really sound like I don't know what I'm talking about. I know that you probably would use an ERCP, an evaluation of it, an ERCP being a endoscopic, scope that goes down, endoscopic retrograde pancreaticocholangiography. So as the scope goes down in the intestines, it's got a little needle thing, like proboscis that can stick out of the side. And so the scope finds the little duct where the gallbladder and bile duct and pancreas all drain into the intestines, which can actually be more than one spot and may not even be a common duct. Common bile duct is what kind of normal is. They both come into one duct, and you got that hole there that they come into, and they can stick that little probe in there, inject contrast, and then take x-rays of the biliary tree and the pancreas, because all their ducts, all of their exocrine ducts are continuous with that, and you put a contrast, you take an x-ray of it, you can see this branching tree of the ducts, and see the typical image of primary sclerosing cholangitis, which has a particular look to it. I don't know, I don't see it. I can tell you it's something other than just a nice, neat, well demarcated line going and branching. It's probably not as pretty as that, and has like what they call filling defects, or areas where you can tell that there's something in the way inside of the vessel. Sally Ann, and I apologize, I'm not getting to everybody. If you want to make sure I get to your thing, use Super Chat. That's a little $sign when you type in your comment. That'll guarantee that you get attention. BooBoo's duly chastised. I'm not sure what she's chastised for. Oh, probably because of all my comments on the every other word. No, BooBoo, you've never done that in our live chats. Oh, and so, okay, I want to see what people said about this. Smash ganglion with the Bible, and Abby saw a video of that. Yes, Bible or any heavy book, and no, we don't recommend it because we don't ship break and other things. Cholangitis, PSC. No, I don't suffer from diabetes. Abby, don't know if it worked, but it was funny. Diabetics. Tossing a question to you, some doctors do not know what this is disease. Do you know what AS is? AS? AS. Anal stenosis? Yes, that's where your butt is tight. There's other ways of saying it in popular culture. The initials are the same, though. Actually, it's TA rather than AS. Most people who continually swear are ignorant. Love those neighbors. Yep, heard them all. Hate that word. Agree with you on the 4-letter words. How long does it take to heal a fractured foot? My friend has one. Varies very much from person to person and break to break and bone to bone. Like when my mom dropped a tuna fish casserole, she swore big time. Sorry you had to hear that. Sally Ann, ganglion cysts on your palm, finger, hurt it, grasping things, doctor aspirated it. It came back. Then they removed it. That was surgery. Oh, it hasn't come back. Good. Yes, surgery is better than aspirating. And adding cortisone injections to the aspiration doesn't seem to help in the studies. Can you tell me if you prefer indwelling or suprapubic catheter? I really don't like to have either one. I feel duly chastised. How long have you been a doctor? I don't know, 20 plus years. Inject, contrast, looking for stones, strictures, aware of bubbles. No, it's spongitis. Can't begin to spell. A spongitis. Not anal stenosis, huh? Are you in family medicine? I am. Family medicine. Have been doing that for most of my career, although certainly emergency medicine was a part of it, and I'm still board certified in emergency medicine. Okay. Hey, you guys, this was fun. I think I'll go ahead and wrap it up, but thank you so much for participating. You guys are the greatest, and I know that, I know you guys enjoy this because you hung around. There's so many of you, and you had so many questions. I apologize for not being able to get to everything. I think it helps if I go into depth on certain subjects rather than just barely skimming on a lot of them. I hope you guys appreciate that. And let me know in the comments, because this is going to be available to you guys afterward. If you have this link, it's not available to everybody, but you guys have this link, and everybody on Patreon will be able to get it because I give them everything. The people at $3 levels or higher. Oh, and you guys, I made a comment about BooBoo Kitty having chats with her. It's because she actually picks the category on Patreon where she's able to participate in our monthly live Google Hangout for super people on the Patreon. If you guys are interested, it's at Auburn Medical Group /Patreon. Or no, it's not. It's at Patreon/Auburn Medical. No, scratch that. Patreon.com/Auburn Medical Group. So it's like you're going to the Patreon site, patreon.com/ you want to see my Auburn Medical Group, Auburn Medical Group /Auburn Medical Group. Patreon.com/Auburn Medical Group. We need to talk about a phone charger for Dr. No. No. There needs to be something to limit this, otherwise we'd be here forever. Thank you. See the building's coming. Ankylosing spondylitis. Yes, that is a problem I won't jump into associated with the HLA-B23 genetic what do you call that? Genetic locus? Anyway, yeah, it has back problems associated with a lot of other problems, kind of rheumatologic in nature, autoimmune disease. So sorry you have to deal with that, Debbie. Me too, Debbie. I don't know what it is, but sorry too. Okay, so I'll wrap this up and make sure it's available to the people who are on Patreon. Of course, anybody who has a link, it'll still work even though I make this unlisted. Until next time, Dr. Mark Vaughan telling you to stay in good health.